And I believe we are live. Welcome back. This is the 8th episode already of our iDryNeedle to the Point podcast. Our guest today, again, one of the very first we reached out to when we kind of launched this podcast. We know her well. It is Lauryn Ginsburg. She's a physical therapist. She's actually been a previous iDryNeedle ambassador. You might know her from the socials, being at SportsFit Physical Therapy on Instagram and Facebook. But just to give a quick intro, I mean, she's a PT, DPT. She has extensive training in dry needling, hours, but also years using it in the clinic. And she's a USAW, so the USA weightlifting certification. And really that's what we're going to focus on today is how she not only manages some of those Olympic lifting, like those weightlifting clientele, but Lauryn, you yourself are a nationally competitive Olympic lifter, yeah?
Yep.
And you have a competition coming up in 2.5 weeks, potentially, as of right now.
Yeah, if it still happens, I'll be flying out to Atlanta, Georgia to compete at nationals in the first weekend of December.
The snatch and the clean and jerk, correct?
Yes, yep, those are the two lifts for Olympic weightlifting.
So I don't know if you saw when we were promoting this, it's like, yeah, Lauryn, she works with athletes. She's a cash PT, but she can also probably lift more than you. That's what we were marketing this as. You are the Olympic lifting PT. So I am your host, Paul Killoren. I'm the president of iDryNeedle. I'm a physical therapist myself. I think you all listening know, Lauryn, I believe you know the spiel. Once we dive in, we're going to try and keep this conversation to 15 minutes or less. So that is quick and dirty. And the topic is today, the Olympic lifting PT. And again, we could have gone down a few avenues with you. Like you have a lot of training in needling. We could have just focused on that. You've actually run your own cash pay private practice for a 1.5 years at this point. So we could have gone down there. But really the topic I think we want to focus on, and part of it is, I failed to mention that you are one of the newest lead faculty for Barbell Rehab. You'll be teaching the Barbell Rehab Olympic weightlifting workshop, hopefully starting live in March.
Yes.
So check that out and check, I guess, at Barbell Rehab out on Instagram as well. But really, that's what I want to be the focus. The title is, you are the Olympic lifting PT. So first of all, how long have you been training, competing, just personally lifting yourself?
So my very first introduction with Olympic weightlifting was actually in college. I was competing for Division III gymnastics at Springfield College, and we did a little bit of weightlifting there. I don't even know if I knew it was called the snatch and the clean and jerk at the time, but that was my literally first exposure. And then I started CrossFit out of college, December 2011. So that was when I really started knowing what the snatch and the clean and jerk was. And then about 4 years ago, I transitioned over from CrossFit to competitive weightlifting. So that was when I had my first actual weightlifting competition. And then I started following a true program and then stopped CrossFit, started just exclusively training in the Olympic lifts. So quite a while in total, but more seriously the last 4 years.
Yeah, that's funny. Didn't even know what it was called. Just cycling the barbell for a few years, and now look at
you. Exactly. Yeah, I kind of gravitated toward it because I was pretty good at it. Apparently it's a thing. Former gymnasts tend to be really good weightlifters. I had no idea at the time, but makes sense.
I believe it. So how do you balance? I mean, that must be a fairly structured, fairly intense training regimen. So how do you balance that with, you also run a cash pay private practice? So how does that life balance work for you?
It's actually somewhat easier now that I work for myself because I can make my own schedule. So I guess two things. I make my own schedule now that I work for myself, and I work in a gym. So I can literally treat a patient in my office, take 2 steps out into the gym, and I can start weightlifting. So there's no commute and travel time and all that involved that I used to have. So selfishly, I make my schedule of treating patients around my lifting. So I know that, I lift 5 days a week, and they usually take anywhere from 2 to 3.5 hours to get my lifting sessions done. So I'll plan what time do I want to lift, and then I'll give myself a little bit of time to like change and eat some lunch and then start treating patients. So it's actually been a little bit easier because I can give myself that schedule and timing to get all my training in. And then it's also, like I said, the location makes it so much easier, takes out all that extra time.
Literally snatches for lunch, it sounds like.
Yeah. Yeah. Sometimes I actually eat and work out at the same time.
That's kind of cool. And obviously you work with, I mean, without saying names, you work with some of the biggest names in CrossFit and in weight training. And really, that's probably a clientele you see a bigger percentage of than most. So if I were to ask, like, what are just some of the most common injuries that are unique to Olympic lifting or just unique to competitive weight training, what would you say they are?
I would say the number one thing I treat with any sort of barbell athlete would probably be shoulders. A lot of shoulder issues just because of the barbell going overhead. So I would say shoulders are probably number one that I see, and then number 2 and 3 are pretty closely tied with like anterior hip pain, hip impingement kind of issues, as well as back pain. The hip pain just because every lift goes through the full squat position, and then the back pain from pulling the barbell off the ground. So you end up with a decent amount of like lower back issues, hip issues, and then lots of shoulders just based on that overhead stability with heavy weight, especially if technique or form isn't quite there or mobility isn't quite there. You just end up seeing, some of those issues. And those are actually kind of for that barbell rehab course that you mentioned that I'm teaching next year. That's where we really kind of go into a deep dive into those kind of 3 specific injuries and how to assess for them and correct them, both for the physical therapist as well as, personal trainers and everyone who might be, coming across clients with those lifts.
Awesome. And you almost answered my follow-up question. And I'm sure this is it depends based on the person or the lift. But do you think more of those injuries you mentioned are due to like the volume of training or the load, or is it more the poor technique or technique adjustments that are the cause?
It's kind of like you said, it depends, and it also like is both. The answer could be both. I would say like the amount of like volume and load, or programming, that usually if it's more than what a person has been doing and it ramps up and there's a lot more volume, then you tend to see more like the tendinopathies, you get the quad tendinopathy or, patella tendinopathy or some shoulder issues. So kind of more just like the inflammation kind of injuries, chronic stuff. But with someone who's got really poor technique, you might see that, classic picture of someone rounding their back on a heavy max out deadlift. That's where I see more of like the acute strains or, disc issues and stuff. Like, deadlifting is perfectly safe for your back if you're doing it correctly, but it's that person who's going for the PR that throws their form out the window or doesn't know how to do it the right way or doesn't have the mobility to get into those positions and they're forcing it. That's when you see more of like the acute injury. So I think it kind of depends on like the level of the athlete. Someone who's got really good movement and technique, you're going to see more of the aches and pains from just like workload, volume, and then you see maybe like a newbie CrossFitter that's like, oh, I can lift a lot of weight, I'm strong, and then they don't have the right technique, and then you see the like, oh, now I can't move tomorrow because I hurt my back kind of injury.
Yep, that makes sense.
Yeah, so I definitely see a lot of both.
And to piggyback on that, so yeah, this is a common question on courses actually, like if specifically for dry needling, how do you manage with needling an acute injury versus more, like you said, the chronic or even the slightly less acute, just like itises and like the inflammation stuff. So for you, how do you use, I guess you kind of painted the picture of 2 different types of injuries, but just in general, how do you use dry needling with your clientele for the injuries and the conditions you just mentioned?
Yeah, so I mean, I would say if someone's coming in with more of the inflammation, itis stuff, I'm using needling more almost from like a mobility standpoint. So someone comes in with a quad tendinopathy or a patella tendinopathy, anterior knee pain. I'm more likely like, okay, you probably have really tight quads because you've been doing a ton of squatting and a lot of volume. So I'm using the needling more to like release some of the trigger points, like lengthen the tissue to take the strain off of the tendon. And then really, following that up with some of the homework stuff like, okay, I want you to stretch your quads now. We're going to do some posterior chain strengthening and we're going to manage, maybe your volume, like take a look at their actual programming and adjust it accordingly so that they can start healing and feeling better. So a lot more, like I said, dry needling for mobility to the tissue that's tight. Whereas someone comes in and they can, they hurt their back on a 1 rep max deadlift the day before, they can barely even get on the table. I'm more using the needling to kind of calm the system down. They might have some acute muscle spasms that we're trying to relax, as well as just getting more into the central nervous system, needling, to calm things down, almost like a little bit of like a TENS setting on the stim, longer duration, and just letting everything relax and calm down. So then we can actually get them off the table and do some gentle, stretching and movement and muscle activation. Whereas they may have not been able to tolerate that walking into the office. Usually after I do a little bit of needling, they're able to get through a little bit more after the, hands-on portion of the session.
Yep, totally. And I guess to go off script, I'm curious because again, this comes up on courses quite a bit. Like, I think you and I agree kind of once you have a positive outcome on the table from needling, you want to reinforce that somehow.
Mm-hmm. Yeah.
And there's kind of this one end of the spectrum, maybe people that work at a desk where you have to encourage them just to move at all.
Mm-hmm.
You probably live on the other end of the spectrum where you have a weightlifter that's like, okay, we just had this change. Can I go lift? Like, do you have any specific parameters as far as percent of 1 rep max, or are there any lifts you encourage or avoid within a certain period or a window after needling?
So mostly I say go for it, go work out. I usually tell my people to not do a 1 rep max. So essentially, I do not want you to max out any lift of any kind right after I needle you, just because their muscles could be more fatigued after, especially with the stim in it and everything. So I tell them no 1 rep maxes, but definitely I want you to solidify the change we just made. So I want you to go through those range of motions and put some weight on there and feel those new positions. I guess the only time I really caution someone more specifically is if we get a huge change in range of motion or mobility afterwards, because what I find is like they're weaker in those new ranges that they haven't had for potentially years and years. So now all of a sudden you get those last, say, 10 degrees of shoulder flexion that they haven't had, and then they go overhead with heavy weight and they can't stabilize it because they're not strong in that new 10 degrees that we just got. So, I'll tell them to go a little bit lighter instead of just don't max out. It might be a little more of like, okay, maybe we keep it around 75, 80% at most, until we're stronger in those positions with, some of the strengthening homework that I'll give them in that end range. So it very case by case, but I would say normally, especially if it's something like a squat or a deadlift that doesn't go through as much range of motion as like maybe a shoulder, I'm like, yeah, go for it, load it. Just be aware that your positions are going to be a little bit different, but it should be, in a really positive way. So most of the time they can actually go and hit some really good numbers with actually like, with more ease, just because it's like, oh, now I'm in the right position. And things always feel lighter when you're in the right position.
Yeah. Yeah. And I totally agree. Like, you need to give them a way to own the position or the new mobility you gave them.
Mm-hmm.
And yeah, I've worked with a few CrossFitters and they ask that question and I give kind of the generic answer of, well, it's probably not a good day to push for a PR or to learn a new lift, but I like your suggestion of go for it. I mean, the 1 rep max is probably a good thing to stay away from in that window, but I've always been curious, especially about Olympic lifting. I mean, the snatch, the clean and the jerk, where it's not just load, but there's some technique to it, but also like you're saying, the overhead position, it's more challenging to control weight in different positions.
Yeah. Yeah, I think my best example that I ran into with that was actually a CrossFitter who was a lacrosse player growing up. And he actually didn't have full elbow extension from gripping the stick for so many years. And we finally got his elbow straight for the first time in so long. And then he was doing jerks overhead with the barbell. And he was like, my numbers are going down because all of a sudden he feels so weak. He hasn't been in that position. And I was like, yeah, there's going to be a little bit of like step backwards at first until you get strong enough. And then you're going to find this big jump in performance once you get strong in those positions. But sometimes that can be really frustrating for an athlete to like hold back while they're getting that new strength and that new range of motion. So depends on, and also like I probably wouldn't needle someone for the first time right before like a big competition because, they don't know how they're going to respond or what outcome you're going to get, from a strength and mobility standpoint. So it's, making sure you're timing it right and giving them enough time to strengthen before they have to then go and perform if they haven't had it before.
Yep. Definitely agree. When we're already at our little time, so I'll try and wrap this up with one more question, and It's a big question, so take as much time as you want. But if we're going to give one piece of advice, let's picture, first of all, a PT that maybe manages a few Olympic lifters, like maybe it's not their full clientele like you. So what's one piece of advice you'd give to that PT? Or what's one piece of advice you just give to an athlete out there that's interested in Olympic lifting or kind of learning the lifts at this point?
I mean, I think the biggest thing is finding a coach, whether it's a weightlifting seminar you can sign up for, or whether it's online, instruction, or, studying certain videos. Like Hook Grip has, amazing slow-mo videos of some of like the world-class athletes. But you really have to understand the technique and the mobility required before I feel like you can really treat that athlete. And you can't just assume it's like, oh yeah, I know what this is, if you haven't really ever put your own body through it, because it's so technical and does require so much mobility that I think, even if it's with a broomstick or a PVC pipe, if you can start going through those motions yourself, you don't have to be competitive with it or put a lot of weight on it. But it's like, once you try it yourself, you might be like, wow, okay, there's a lot more that goes into it that I think you have to realize before you start treating these patients and really being able to give them the right kind of homework or the right assessment. Because if you don't go through those kind of extremes for mobility, for example, that a snatch requires, it's going to be hard to really, treat them. So even if it's just like a little weekend kind of seminar that you can go through yourself as a clinician or someone who's never done those lifts before, I think that can be really eye-opening and really helpful. And then, deciding what you want to do with it as an athlete or to treat those athletes yourself as a clinician. So,
which is why we have great faculty like yourself, but courses or continuing ed like Barbell Rehab. Because I totally agree. It's one of those things that if you haven't experienced it, and really my only experience with Olympic lifting was playing Division III college football. So I kind of got the basics. I definitely entered college not knowing what a clean was. Like we just did the squats and the benches in school. And there's definitely a learning curve as an athlete, but you have to then turn around, use your words, use your cues as a clinician. I totally agree that experience, even just a weekend course, is worth it if that's ever going to be a patient or an athlete that walks into your clinic.
Yeah, which really, I mean, it doesn't have to be a competitive weightlifter, like you said. I mean, it could be a football player, it could be any other athlete who's using the Olympic lifts to strengthen for their sport, because you want to be able to treat all those people, not just the Olympic lifters or the CrossFitters. So
that's great. Well, unfortunately, that is our time. I want to thank you so much for your time today, Lauryn, for being on. You can follow her again at SportsFit Physical Therapy on Instagram, Facebook, and the socials. Or again, check out at Barbell Rehab for her upcoming course next year. Good luck in your competition.
Thank you.
Do you have a goal? What are you going for with the snatch and the clean and jerk?
I'd like to hit between 78 and 80 on the snatch and at least 100 on the clean and jerk.
Awesome. And is that stuff live? I think I've seen you post links in the past.
Yeah. So as of right now, they have a tentative schedule. So I should be competing around 11:40 a.m. on December 5th. But once that schedule is final, I'll post the link with the live stream and my exact session time on there. So if anybody wants to watch, they can watch it on the live stream.
And you have some pretty BA pictures that come out of it too.
Yeah, that's
posted some on social, but
exactly.
That's cool. Well, again, that's the show. Thank you, Lauryn. We will not have our weekly Wednesday to the point next week for Thanksgiving, but we will be on the week after that, and we will continue until the end of the year. We're all booked up even past into January, but actually have met a few people on courses recently that are actually listening. So it's awesome. Thank you to everyone who shows up live or just catches us afterwards. If you're not listening to this live, it will be on that link in our profile, which is our Podia platform. Otherwise, we'll put it on our YouTube channel, or you can hear the audio on Spotify, iTunes, Google Podcasts, wherever you listen to your podcasts. So thanks again, Lauryn. That's the show.
Thanks for having me.
Have a great week, everybody.